and today we are going to discuss about the new topic that is related to pediatric nursing, and the name of the procedure is vital signs. That is very important and backbone of our nursing. Introduction. Vital signs are done to check functioning and the rhythm of the essential organs like heart, lungs, and it is a clinical procedure and a part of physical assessment. Vital sign includes temperature, pulse, respiratory rate, and blood pressure. Then the definition of vital signs. Vital signs are measurement of the body's most basic functions that reflect essential body function, including heart rate, respiratory rate, temperature, and blood pressure. Then the purpose of recording vital signs is to establish a baseline on admission to a hospital, clinical, professional, office, or other encounter with the healthcare providers. Then, when to take vital signs? At the time when client admitted in the hospital, and according to the need and physician orders, according to the hospital protocol or policies, standard clinical practice assessing client during home visit, and before and after any surgery or invasive diagnostic surgical procedure, before and after administration of the medication that affect the cardiovascular system, respiratory system, and neurological system. Then vital signs includes temperature, respiratory rate, heart rate, and blood pressure, and we have to discuss these four one by one in the next slides. Important consideration: a client's normal value may differ from standard range due to body build, hereditary, genetics, lifestyle, etc. Normal value of vital signs. Normal ranges of vital signs. If we talk about temperature, the range of normal temperature in adults and children is same. In Celsius, 37 degrees Celsius, or in Fahrenheit, 98.6 degrees Fahrenheit. And if we talk about pediatric department, then the normal range for the children or infant is between 36.5 degrees Celsius to 37.5 degrees Celsius. Temperature reference does not change with the age. And respiratory rate for adults, 12 to 20 breaths per minute is considered as a normal, and for children, if infant less than 12 months of age, the normal respiratory rate is 30 to 60 breaths per minute, and for toddler 1 year to 3 years, 24 to 40 breaths per minute, 22 to 34 breaths per minute in the age group 4 to 5 years, which we call preschool, and the school age 6 to 12 years, the normal range of breathing 18 to 30 breaths per minute, and for adolescents 13 to 16 years, 12 to 16 breaths per minute, and for adult 12 to 20 breaths per minute, right? Heart rate for adults 60 to 100 beats per minute, and for children according to age 0 to 1 month 70 to 190 beats per minute, 1 to 11 months 80 to 160, and 1 to 2 years 80 to 130, 3 to 4 years 80 to 120, 5 to 6 years 75 to 115, 7 to 9 years 70 to 110, and above 10 60 to 100. Okay, then after that, blood pressure for the age group 1 to 12 months, the normal range is 90 by 60, and 1 to 5 years 95 by 65, 14 to 19 years 117 by 77. Then next is going for adult. Articles. Which kind of articles we require for the vital signs? Thermometer, red or blue, sphygmomanometer or BP apparatus, then stethoscope, sterilium, cotton balls, small bowel, kidney tray, and paper bag. These all are the articles which we required for vital signs. Then body temperature. Body temperature, there are two kind of body temperature, like core temperature and skin temperature. If we talk about the core temperature, it is the temperature of body tissues controlled by hypothalamus, and the skin temperature rise and fall in response to environment and atmosphere of heat loss to external environment. Temperature is the lowest in the morning and highest in the evening and totally depends upon the environment, right? Then the next is types of thermometers. There are three kind of thermometers are there. First one is glass thermometer, which has the mercury expand in response to heat, and second one is infrared tympanic ear thermometer. It is a sensor probe shaped like otoscope. Like the third one is electronic thermometer. It is a heat sensitive probe, reads in seconds. Then the next is this is the glass thermometer. Then this one is infrared tympanic ear thermometer and electronic thermometer. Next one is sites and procedure. We can take the temperature orally. Posterior, where we place the thermometer, posterior sublingual pocket under tongue close to carotid artery. And the precautions patient can use, they do not take any hot or cold drinks or any kind of things, do not eat or they do not smoking 20 minutes prior to the temperature, prior checking to the temperature, and do not eat or drink anything hot or cold. Okay, leave to place for 3 minutes, and not used for small children because they bite tongue. Next is axillary, bulb in center of axilla, lower arm position across. It is non-invasive, good for children, leave in 5 to 10 minutes, measure 0.5 degrees Celsius, lower than oral temperature, less accurate because less blood vessels nearby. Then rectal, sideline with upper leg flexed, insert lubricated bulb, half inch for infants. When unsafe or inaccurate by mouth, rectal side is used, leave in place for 2 to 3 minutes, measures 0.5 degrees Celsius higher than oral. Then ear, rapid measurement is done within 2 to 3 seconds. It's easy to assess, close to hypothalamus, sensitive to core temperature, changes in adult, pull pinna up and back, in children pull down and back, otitis media can distort reading. Then temperature checking procedure in axilla. First of all, wash hand. Why? Reduce transmission of microorganisms. Draw curtain around bed or closed door, provides privacy and minimize embarrassment. Then assist client to supine or sitting position, provides easy access to axilla. Move clothing or gown away from shoulder and arm, exposes axilla. Prepares glass thermometer following step A, 2 or 3. Mercury must be below client temperature level before insertion. Insert thermometer into the center of axilla, lower arm over thermometer and place arm across chest. Maintains proper position of thermometer against blood vessels in axilla. Hold thermometer in place for 3 minutes or according to agency policy and protocol. Studies as to proper length of time for recording vary. They concluded that changes after 3 minutes had little or no significance. Remove thermometer, remove plastic sleeve, and wipe off remaining secretions with tissue. Wipe in rotating fashion from fingers toward bulb. Dispose of sleeve and tissue in appropriate receptacle. Avoid nurses' contact with microorganisms. Wipe from least contamination area to the most contamination area. Read thermometer at eye level. Ensure accurate reading. Inform clients to reading. Promotes participation in care and understanding of health status if we gain the confidence of the patient. Store thermometer at bedside in protective covering container. Glass thermometer should not be shared between clients unless terminal disinfection is performed between each measurement. Storage container prevents breakage and reduces risk mercury wells. Points to keep in mind while measuring temperature. Measure balance between heat loss and heat produced in body. Heat produced by metabolism of food, by muscles and gland activity, conversion between Fahrenheit and Celsius. Next one is keep clinical thermometer at eye level. You have to check the temperature with the help of thermometer at the eye level. You can check at this level, right? Then next is pulse rate. Pulse rate means heartbeat per minute. Pulse is never measured using thumb because thumb has a small artery which leads to false measurement. You have to measure the pulse rate with these two fingers like this, right? Pulse is never measured with the thumb. Usually it is done using first two fingers of hands, placing thumb down the hand for better grip and palpation. I hope you have clear with this. Sites of measurement: radial pulse, carotid pulse, brachial pulse, ulnar, femoral, popliteal, temporal, facial, dorsalis, pedis and posterior tibial. You can understand with the help of this image. First one is temporal, which is situated on the side of our head. Then the facial artery, then carotid artery, brachial artery, radial artery, femoral artery, popliteal artery, posterior tibial artery and dorsalis pedis arteries, right? Next one is how we can do the procedure. First one is assess rate, rhythm and strength using palpation and auscultation. Then the next one is pulse deficit. What is that? The difference between the radial and apical pulse indicates a decrease in peripheral perfusion from some heart condition, that is arterial fibrillation. Then checking at different sites, peripheral, place second, third or fourth finger lightly on skin where an artery passes over an underlying bone, and do not use thumb. You know why, we have already discussed this point. Count for 30 seconds and then multiply into 2. If irregularity is there, then count for 1 minute. Then apical, beat of the heart at its apex or point of maximum impulse, fifth intercostal space, mid-clavicular line just below the nipple. Listen lub dub for a full minute. Lub, close of AV valve, tricuspid and mitral valve, and dub, close of two semilunar valve, aortic and pulmonic valve. After that, for children, sometimes stethoscope is used if difficulty is seen. Pulse is obtained through pulse oximeter. Pediatric probe is small in size than adult and attached to thumb and big finger to thumb. Then assess rate, rhythm, strength and tension. Rate for adult, number of pulse 60 to 100 beat per minute. Average 80 beat per minute. Tachycardia, when the term tachycardia known as when the normal range greater than the norm. In tachycardia, the pulse rate more than the normal, and in bradycardia, the pulse rate lower than the normal. And for pediatric, increase or decrease then decided range. After that is strength. We can use this method. After that, respiration rate. Respiration rate means inhalation and exhalation. In 1 minute, it is known as respiratory rate. Inhalation and exhalation is automatic and controlled by medulla oblongata. It is the respiratory center of the brain, and one inspiration and expiration is equal to 1 cycle. Normal breaths theoretically, while men and young children breathe diaphragmatically. Assess after taking pulse while still holding hand, so patient is unaware you are counting respirations. It is done using observation method and sometimes stethoscopes, with the help of stethoscope, right? Then assessing respiration, the main points are rate, increase or decrease in normal rates. Tachycardia, when the respiratory rate increase, tachypnea when respiratory rate increase, and bradypnea when the respiratory rate down or decrease, fall. Depth, normal. Deep and even movements of chest, shallow. Rise and fall of chest, minimal. SOB, shallow and rapid. Then rhythm, normal rhythm includes inhalation, exhalation and pause. Then after that to blood pressure, fourth vital sign. The force exerted by blood against the wall of the artery. It is also called as pressure of blood within artery. Blood pressure, it is divided into two, systolic and diastolic. What is systolic? Force exerted against the arterial wall as ventricles contract and pumps blood into aortic. Maximum pressure exerted on vessel wall. And diastolic, arterial pressure during ventricular relaxation when heart is feeling minimal pressure in artery. It is known as diastolic. These all are the cuffs for sphygmomanometer or BP apparatus, and it is according to the age. The very small for small children, then after that it increased according to the age group. Next one, there are main points and the articles, main articles. First one, if we talk about the stethoscope, a stethoscope is used to hear the sound of blood rushing back through the artery. The first thumping sound is the systolic blood pressure. When the thumping sound is no longer heard, that's the diastolic pressure. And if we talk about the cuff, a cuff is wrapped around your upper arm, here or here. Then dial, a numbered dial or a column of mercury can be used to record the blood pressure reading. Then pump, a pump inflates the cuff to stop the blood flow in your artery for a few seconds. And valve, from where we can set adjust. A valve lets some air out of the cuff which allows the blood flow to start again. And the procedure, there are 12 steps, and as you know, we have used this procedure in everyday life. First of all, we have to use the cuff around our upper arm. Then we find out the pulse and position or place our stethoscope. Then we fill the air with the help of pump, and after that we have to check and heard the sound with the help of stethoscope. These all are the procedure. And after that, after recording, we have to remove the cuff from the patient, from the upper arm of the patient. Then blood pressure is lower extremity. Best prone position, if not supine, knee slightly flexed to locate popliteal artery, back of knee, and large cuff 1 inch above artery located. Same procedure as arm. If unable to palpate pulse, then we can also use Doppler stethoscope. Then important points while measuring BP in arm: palpate brachial pulse, position of cuff 1 inch above, arm at level of heart, manometer at eye level. Then methods of recording vital sign. Methods of recording: maintain RD chart, recording vital signs on RD basis, maintain graphs, plot points on figures and joint plotted points. Easy to make out difference between two plotted figures. Entry in iPads reduces errors. The paper vital signs recording have an error of 18.75% and the wireless system has an error rate of 0%. Then record vital signs like this. This is the good example for you, and this is the vital sign flow sheet. Here you can note the BP, pulse, temperature, respiratory rate, weight of the patient, then date, which date you have recording the vital sign. After that, the data of the patient, also their patient name, then date, then CR number, then all the identification according to the hospital policy are there. Okay, after that I think you have clear the vital signs. If you have any doubt, kindly talk with me regarding that. I feel very happy to help you. Thank you very much.